Thank you, Mr. Chairman. Thank you to our panel of witnesses. Really appreciate the conversation that we're having today. I wanted to start and raise once again an issue that came up in previous questioning relating to violence and harassment faced by healthcare providers and how that impacts the question that we're tackling today. A recent study found that more than 2/3 of nurses reported experiencing verbal abuse, and 44% reported being subject to physical violence. Last year, I was proud to reintroduce the Workplace Violence Prevention for Healthcare and Social Service Workers Act. This act would require healthcare and social service employers to write and implement workplace violence prevention plans to prevent and protect their employees from violent incidents. Violence against healthcare workers is totally unacceptable, and we need, I think, to do more to provide protection. Dr. Zanton, I would like to ask you to reflect on how violence against healthcare workers contributes to reduction of staffing levels, burnout, and the consequences of reduced staffing for patient safety. But since Dr. Swaney also raised this, I would like to call on you additionally to comment.
Thank you for the question, Senator. Absolutely, it's an issue. I think, we're in the middle of a mental health crisis and a substance use crisis, and the way that the country feels more and more fractured, I think all of those together add to, I talk to nurses who say, I used to be the hero walking into their room, and I used to have just respect based on being a nurse, and now I don't always get that, and suffer verbal abuse and sometimes physical abuse. I do think that it's been mentioned that hospitals are going to shrink and become more and more, operating rooms and intensive care units, and that almost everything else will happen out in the community. I do think that when people are at home and in their community and in lower cost settings and more family-centered settings, that some of that will dissipate.
Thank you. Dr. Swaney.
Yeah, I will say it's 28 years of practicing medicine, including my training, and I've never seen such a charged environment as every day throughout our health system. At our safety huddle, our daily safety huddle, there's an issue around either verbal or physical abuse to a healthcare provider. So it is a true crisis. And, like I said, we've been working with our state legislators to make sure that it's a felony. We've put up signage, and also it's not just the as you've pointed out, the physical abuse, but the verbal abuse. So part of that state bill was that if you interrupt the ability to deliver health care by being verbally abusive, that also is now a crime. So.
Well, it also sounds like you said your healthcare system is taking proactive steps. We want to see that more uniform around the country. I also, turning to a different topic, I've been proud to lead the Bipartisan Palliative Care and Hospice Education and Training Act with my colleague, Senator Capito. The bill would grow, improve, and sustain the palliative and hospice care workforce. It addresses each aspect of the healthcare workforce pipeline. Importantly, the bill provides grants to schools of medicine and teaching hospitals to train physicians who plan to teach, and establishes fellowship programs to give providers the opportunity to learn more about providing palliative and hospice care. Dr. Swaney, could you briefly describe why it's important for academic health systems to provide physicians with both training to teach and opportunities to build their skills, upskill? And as a follow-up, how does additional training support or alleviate burnout?
Senator Baldwin, thank you very much for that question, because 15 years ago I created a course to train residents in the intensive care unit around death and dying and palliative care. And in that course, we taught residents with real cases they had experienced during their month in the intensive care unit. And we had a debrief at the end where we went through what they learned, but really kind of an emotional reset for them. And there was some real critical learnings from that. One of them was, while we were teaching them skills about how to have difficult conversations and how to manage patients that are critically ill, we quickly learned that one of the most important parts of the course was actually the benefit to the residents to be able to debrief the mental health and wellness for the residents to be able to speak about what they had experienced in that month. Because remember, for many of these young medical students and residents, that's their first experience with death and dying. So it has an incredible benefit to the wellness of our healthcare workers, and I've experienced that firsthand through that course. And I want to thank you for putting that legislative force. We're trying to start our own fellowship in palliative care. That's the next program that we actually are going to start. And it's critically important for the way we practice medicine. As our population ages, it's critically important, not just for our healthcare providers, that we be able to provide the appropriate care for patients in their time of need.